Hey everybody, Jen here from Resolve Physical Therapy, bringing you our next installment of Wednesday Wisdom. Today we'll be featuring Dr. Kelcie Harris, and we're going to be talking about approaching treatment from a holistic perspective. So welcome, Dr. Harris. Thanks for being here.
Yeah.
Do you want to give everybody a short bio, just kind of introduction on yourself and your qualifications and that type of thing?
Yeah, sounds great. I'm Dr. Kelcie Harris. I'm a naturopathic physician here in Bend. I do primary care with a focus on women's health and natural pain management. I'm originally from Portland, Oregon. Went to undergrad at University of Oregon and then medical school at the National University of Natural Medicine in Portland. Oregonian, born and raised.
Nice. Very rare to find here in Bend sometimes.
Yes.
So for some people who may not be aware, can you explain the difference between a naturopath physician and a traditional physician?
Yeah, so here in Oregon, our licensure allows us to be full primary care providers, meaning I can prescribe all the same medications that your normal primary care MD can prescribe. I can order labs, imaging, and use conventional diagnostic criteria for diagnosing and treating. In addition to those conventional treatments, I'm also trained in herbal medicine, clinical nutrition, hydrotherapy, some manipulative techniques, kind of what a chiropractor does, only our own version. And yay!
Okay, so one of the other interesting things that you do is something called Prolotherapy, which is a type of injection which provides a great alternative for people who may not want a traditional steroid injection or who may not be able to have a steroid injection. So can you explain a little bit further what prolotherapy is?
Yeah, so prolotherapy, you can think of it kind of like the opposite of a steroid injection. So with a steroid injection, the goal there is to cut out all of the inflammation in the damaged joint, ligament, or tendon to cut your pain. With prolotherapy, we are using a natural solution, which is usually dextrose-based, which is sugar, because it's mildly inflammatory. So we are injecting a mildly inflammatory solution into a damaged joint, ligament, or tendon to try to reinitiate your body's healing cascade so your body can actually heal those tissues and resolve pain in that way.
And in the end, it does end up making the tissues stronger, correct?
Yep, Prolo is really good for if someone has what we call ligamentous laxity, because it helps the ligaments to tighten up. A lot of times pain is caused by stretching of the tendons, by the nerves firing pain signals. So if we can tighten those up, it's oftentimes beneficial for decreasing pain.
Okay. So who do you see as the ideal candidate for prolotherapy? I mean, is there anybody that shouldn't get this type of injection?
Yeah, I only inject people that I think are going to heal well. So essentially, the healthier you are as an individual, the better you're going to respond to this therapy. So I typically recommend people who are active, eat a healthy diet. I do not inject people who smoke. I do not inject people who have diabetes, just because you have decreased ability to heal. Anybody who has a clotting disorder, coagulation disorder is not a candidate for prolotherapy as well.
Okay. And where do you see the most benefit? I mean, in terms of, I know you can essentially inject most joints of the body, correct? Is there any area that you see that you get more benefit with, or where do you see most of the research at with prolotherapy?
Yeah, most of the research shows is with the knee. Knees respond very well to prolotherapy. Hips respond well also. It really is dependent on the individual, their injury, how long they've had the injury, and their body's ability to heal. But knees are great.
Perfect. And then in terms of using physical therapy either before or after prolotherapy, how does that play into the overall course of treatment for a patient who may be considering an injection like this?
Yeah, I recommend all my patients who are undergoing prolotherapy treatment to be doing PT concurrently along with the treatment. Strengthening muscle groups that are surrounding the joint is just going to help the joint heal and have a more correct function.
Perfect. So if you want to learn more about prolotherapy, or if you're looking for a primary care physician who's based more on the holistic natural approach, you can find Kelcie at Lumos Medical Center here in Bend, or you can check her out on Instagram at Dr. Kelcie Harris.
Thank you.
Thanks, Kels.